The effects of high cholesterol on the body. Cholesterol is a waxy substance found in your blood and in your cells. Your liver makes most of the cholesterol in your body. The rest comes from foods you eat. Cholesterol travels in your blood bundled up in packets called lipoproteins. Cholesterol comes in two forms. Low-density lipoprotein, LDL, is the bad, unhealthy kind of cholesterol. LDL cholesterol can build up in your arteries and form fatty, waxy deposits called plaques. High-density lipoprotein, HDL, is the good, healthy kind of cholesterol. It transports excess cholesterol out of your arteries to your liver, which removes it from your body. Stroke. Cholesterol buildup in the arteries can also block a blood vessel to the brain and cause a stroke. Pain in the jaw. Jaw pain can be a symptom of a heart attack, which can be caused by cholesterol deposits in arteries. Chest pain. When your heart doesn't get enough oxygen-rich blood, you can develop chest pain called angina. Heart attack. If plaque buildup inside a coronary artery cuts off blood flow to the heart muscle, the affected part of the heart muscle can die. This is called a heart attack. The liver produces cholesterol. Your liver and other cells make about 75% of the cholesterol your body needs. The other 25% comes from foods you eat. Gallstones. Excess cholesterol can build up into hard, painful stones inside your gallbladder. Numbness in the legs. Hardening of the arteries from excess LDL cholesterol can cause numbness in your legs or feet. Brain blockage. Excess cholesterol can block arteries to the brain, increasing your risk for a stroke. Effects on memory. Too much cholesterol can contribute to heart disease and stroke, which are both risk factors for memory issues. High cholesterol on its own has been linked to mental impairment and dementia. LDL in arteries. LDL cholesterol builds up inside artery walls and forms sticky plaques. This buildup can lead to a stiffening and hardening of the arteries, called atherosclerosis. Reduced blood flow. As the buildup of cholesterol plaques narrows and stiffens arteries, it limits the amount of blood that can flow through them. Stomach pains. Too much cholesterol can cause gallstones to form. Sudden abdominal pain is a symptom of gallstones. HDL transport. This healthy form of cholesterol picks up extra cholesterol in your arteries and carries it back to the liver for removal. Cholesterol itself isn't bad. Your body needs some cholesterol to make hormones, vitamin D, and digestive fluids. Cholesterol also helps your organs function properly. Yet having too much LDL cholesterol can be a problem. High LDL cholesterol over time can damage your arteries, contribute to heart disease, and increase your risk for a stroke. Getting your cholesterol checked at regular doctor visits and lowering your heart disease risk with diet, exercise, lifestyle changes, and medication can help decrease complications associated with heart disease and improve quality of life. Cardiovascular and circulatory systems. When you have too much LDL cholesterol in your body, it can build up in your arteries, clogging them and making them less flexible. Hardening of the arteries is called atherosclerosis. Blood doesn't flow as well through stiff arteries, so your heart has to work harder to push blood through them. Over time, as plaque builds up in your arteries, you can develop heart disease. Plaque buildup in coronary arteries can disrupt the flow of oxygen-rich blood to your heart muscle. This may cause chest pain called angina. Angina isn't a heart attack, but it is a temporary disruption of blood flow. It's a warning that you're at risk for a heart attack. A piece of plaque can eventually break off and form a clot, or the artery may continue to become narrowed, which can fully block blood flow to your heart, leading to a heart attack. If this process occurs in the arteries going to the brain or within the brain, it can lead to a stroke. Plaque can also block the flow of blood to arteries that supply blood to your intestinal tract, legs, and feet. This is called peripheral arterial disease, PAD. Endocrine system. Your body's hormone-producing glands use cholesterol to make hormones such as estrogen, testosterone, and cortisol. Hormones can also have an effect on your body's cholesterol levels. Research has shown that as estrogen levels rise during a woman's menstrual cycle, HDL cholesterol levels also go up, and LDL cholesterol levels decline. This may be one reason why a woman's risk for heart disease increases after menopause, when estrogen levels drop. Lowered production of thyroid hormone. Hypothyroidism. leads to an increase in total and LDL cholesterol. Excess thyroid hormone, hyperthyroidism, has the opposite effect. Androgen deprivation therapy, which reduces levels of male hormones to stop prostate cancer growth, can raise LDL cholesterol levels. A deficiency of growth hormone can also raise LDL cholesterol levels. Nervous system. Cholesterol is an essential component of the human brain. In fact, the brain contains about 25% of the body's entire supply of cholesterol. This fat is essential for the development and protection of nerve cells, which enable the brain to communicate with the rest of the body. While you need some cholesterol for your brain to function optimally, too much of it can be damaging. Excess cholesterol in the arteries can lead to strokes, a disruption in blood flow that can damage parts of the brain, leading to loss of memory, movement, difficulty with swallowing and speech and other functions. High blood cholesterol on its own has also been implicated in the loss of memory and mental function. Having high blood cholesterol may accelerate the formation of beta-amyloid plaques, the sticky protein deposits that damage the brain in people with Alzheimer's disease. Digestive system. In the digestive system, cholesterol is essential for the production of bile, a substance that helps your body break down foods and absorb nutrients in your intestines. But if you have too much cholesterol in your bile, the excess forms into crystals and then hard stones in your gallbladder. Gallstones can be very painful. Keeping an eye on your cholesterol level with recommended blood tests and lowering your risk for heart disease will help improve your overall quality of life.